Hi, I'm Bradley Byrne, a Senior Risk Management Consultant with ProAssurance. The lack of predictability and the potential long-term effects of a natural disaster can cripple an unprepared healthcare entity. Proper emergency management preparation and mitigation can vastly decrease vulnerabilities during a natural disaster. Once a hurricane is moving inland or a fire is raging outside your practice door, it's too late. You need to know what you're going to do before it happens. Natural disaster mitigation strategies are unique in that they focus on reducing the severity of the impact instead of preventing the hazard. A risk assessment should provide the basis for mitigation strategies to improve readiness, response, and recovery. Part of the risk assessment is identifying potential geographic vulnerabilities in your practice locations. For example, geographic vulnerabilities include hurricanes in coastal areas, earthquakes on the West Coast, and blizzards and ice storms in increasingly expanding areas across the United States. Based on the risk assessment, you can prioritize facility-specific mitigation measures such as redundancy of power, communications, and data management systems. For example, you may find that you need to obtain uninterruptible power supplies, or UPS, and emergency standby generators for critical equipment, install watertight sub-basement doors, reinforce tornado and earthquake safe rooms, and install window film to prevent injuries from shattered glass. In addition to mitigation measures identified in your risk assessment, ensure you comply with mitigation activities required by law, professional organizations, and government programs such as the Joint Commission Emergency Management Elements of Performance and the Centers for Medicare and Medicaid Services Emergency Preparedness Rule. Preparedness involves a continuous process of planning, training, testing, evaluating, and correcting for each vulnerability identified in the risk assessment. Plans, agreements, protocols, and policies should be developed for emergency response actions like evacuating patients to another facility, meeting essential building utility needs, and communicating with various stakeholders. Developing a thorough mitigation and preparation plan can put healthcare providers in the best position possible to focus on their response and recovery. For additional natural disaster resources and strategies, visit the ProAssurance Natural Disaster Mitigation, Preparedness, Response, and Recovery website.